Okay, good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM Institutes, and today we are doing this speaking topic. And this is the topic basically that where we are in the hospital outpatient clinic. So we are in the hospital, but there is an outpatient clinic kind of OPD. So you're in that particular clinic, and your patient is 48 years old and is being discharged after having surgery for the carpal tunnel syndrome. So basically, the patient is being discharged from the hospital itself, and he had a surgery of carpal tunnel syndrome, an incision in the palm of the hand to cut through the ligament, relieving pressure on the median nerve. So there was a pressure on the median nerve. So for that, incision was important to cut through the ligament which was putting pressure. So basically एक ऐसी सर्जरी थी जहाँ पे ligament pressure डाल रहा था नर्व पे. तो कार्पल टनल को रिलीज करने के लिए ऑपरेशन था, सर्जरी थी छोटी सी. एंड यू आर सीइंग द पेशेंट टू गिव इंफॉर्मेशन ऑन द वुंड केयर. कंफर्म रीजन फॉर सीइंग द पेशेंट. तो आपको बताना है कि उससे कंफर्म करो कि आपकी कार्पल टनल सर्जरी हुई थी और आप उसको इंफॉर्मेशन देने आए हो ऑन वुंड केयर. तो जो भी वुंड बचा है उसकी केयर कैसे करनी है घर जाने के बाद. सो आपको ये बताना है दैट आई एम हेयर I am here to help you with your surgery as you underwent this carpal tunnel syndrome release. So how are you feeling after that? ये पूछना है how are you feeling, and also I am here to discuss about the information about the wound care. So इस पॉइंट को आप बाद में बोल सकते हो. पहले आप ये बोल सकते हो सर्जरी के पास आप कैसा फील कर रहे हो, फिर आप कह सकते हो अच्छा I am here to give you information about wound care. So first of all, I would like to give you information that first of all, outer dressing will be removed in one day or maybe after 24 hours, and the rest of the dressing would be left upon the list. तो जो outer dressing है उसे हटा देंगे, जो अंदर की dressing है वो वहां पे रहेगी. And it is important for you to keep the dressing clean and dry. Also, we would like to advise you on the time scale for healing. Approximately it takes 2 weeks, and the removal of the sutures will be done after 10 to 14 days. Are you understanding everything? Yes, nurse, I am understanding. Okay. Then also I would like to warn you, or I would like to tell you that it is not good for you to swim until wound is fully healed. But nurse, I cannot survive without swimming because I am a swimmer. I am a international swimmer, and for me swimming is everything. See, I understand that you are a swimmer and it is very important for you to swim professionally, but at this point of time it is not a right decision because it can cause infection and also can prolong your healing time. But nurse, I would wear a plastic. See, also even if you wear a plastic or if you take the waterproof dressing, then also there are some chances of water to seep in through the dressing, and that can cause water to seep in and can cause infection. So please understand at this point of time, it is not possible for you to swim. Explore patient's option, patient's understanding about the care of hand. So have you understood everything about what I have told you? Yes, nurse. Okay, that's great. Now I want to remind you about the care of hand is that you need to elevate your hand to minimize the swelling, and also you can use your hand only lightly for the first 48 hours. That means you should not do anything heavy or should not pick anything heavy. Also, you should keep on doing finger mobility exercises, and pain relief medications would be required if you feel the pain, or maybe pain relief medications can be taken as per the requirement. तो जब भी as required word दिया होता है तो वहां पे बोलो as per the requirement. Remind patient about the precaution. Also, I would like to remind you about the precautions. तो ये चीजें रिमाइंड करनी है, यानी डॉक्टर ने पहले ही बता दिया होगा कि केयर ऑफ हैंड कैसे करनी है. तभी आपने पूछा डू यू रिमेंबर व्हाट डॉक्टर टोल्ड यू अबाउट द केयर ऑफ हैंड, तो कहेगा मुझे थोड़ा थोड़ा याद है. तो आप कहना मैं आपको रिमाइंड करवाना चाहती हूँ, ये करना है आपको, हैवी लिफ्ट नहीं करना. एंड डू यू हैव एनी अदर कंसर्न, फिर वो कहेगा मेरे को डिस्चार्ज के बाद की कंसर्न है, तो कोई बात नहीं, फॉलो अप अपॉइंटमेंट हैज ऑलरेडी बीन फिक्स्ड. So here is the information about the follow-up appointment that you need to come after every 2 days or after 2 days, and then we will see your progress. And also you need to take care of the wound and about your medication as well, which I have already told you. Hand exercises should be performed. So I'm giving you a leaflet about all these things. Also, I would like to tell you that if there is any fever, swelling or increased pain, then in that case medical attention would be required. That means you need to come to the OPD straight away if you feel any kind of these things. So that is how you execute your role play. Again, I have told you that you will get 3 minutes to prepare. 3 मिनट्स में आप कुछ भी लिख सकते हो। तो मैंने आपको हमेशा ये बताया फर्स्ट लाइन जरूर लिखनी है 3 मिनट्स में, जरूर लिखनी है, बिकॉज फर्स्ट लाइन इज द मोस्ट ट्रिकी लाइन। और हम बहुत एंशियस होते हैं जब हम पेपर में बैठते हैं, तो इसको पहले लिख देना कि गुड मॉर्निंग, माय नेम इज भूपेश and I am a nurse here. So I am here to inform you. Yeah, I am here to ask you about your progress after surgery. So how are you feeling? आप सिंपली ऐसे पूछ सकते हो, ये लाइन आपको जरूर लिखनी है। फिर वो बताएगा that I am feeling this and this and this. That's great. You are feeling better. So now I would like to tell you. Now I would like to inform you about the wound care. So that is how you will start the role play. बाकी टास्क आपको बहुत ज्यादा मुश्किल नहीं है क्योंकि बहुत कम क्वेश्चन है। तो इसमें जो भी आप लिखना चाहते हो, जो आपको मुश्किल लाइन लगी, वो आप लिख सकते हो। तो अब मेरे लिए इजी है, अब मैं अच्छे से आपको बोल के दिखाता हूँ कि पेपर में कैसे बोलना है। जो मैंने पहले बोला वो रफ है, अब पेपर में कैसे बोलना है। Good morning, my name is Bhupesh and I'm a nurse over here. So I'm here to ask you about the progress after the surgery. So if you don't mind, can you tell me how are you feeling after the surgery? Well, nurse, I'm feeling all right. Okay, so that's great that if you are feeling good. And is there any problem that you are facing at the moment? No, nurse, really. I'm just worried about few things, that how would I manage after getting discharged. Don't worry. I am here to inform you about the information about the wound care only. So let me tell you this information one by one. First of all, it is very important for you to understand that outer dressings would be removed in 24 hours, and after that the wrist dressing would be kept in place. So basically the outer dressing would be removed, however the wrist dressing would be left behind in the place. And it is very important for you to keep the dressing clean and dry, because if it will not be dry or get sweat, it can lead to infections. So please make sure that you keep it clean and maintain the hygiene, and also you should keep it dry. Is it all good? Are you understanding my point? Yes, nurse, I am understanding. Okay, that's great. So I would like to take you forward to give you advice on the time scale for the healing. So approximately it's going to take 2 weeks for the healing, and also the removal of the sutures will be done after 10 to 14 days depending upon your progress. How does that sound? Yeah, that sounds good. Okay, then after 2 weeks approximately your wound will heal as well as your sutures will be removed. So also I could see from your case notes that you are a swimmer. So at this point of time, swimming is not a very good idea. It can lead to infection, as I have already told you that the water can seep in through the dressing and can prevent proper wound healing. So it is very important for you to avoid swimming so as to avoid the risk of infection. And also, if there is any kind of infection, your healing time will be prolonged. So please understand, it is very important instruction to be followed. But nurse, I can't follow this instruction. Swimming is my life. I can't survive without swimming. See, as I have just told you, that there is high risk of infection and even the healing time would be prolonged. So please understand, swimming is not good at this moment. But nurse, I will wear some plastic. I will wear some waterproof dressing. After that, maybe I would be able to swim. Again, I would like to tell you that it is not right and it can lead to malicious effects. Rather, you will have more problems. It can lead to complications. So please understand, plastic is ineffective for the complete dryness. At this point of time, your wound, your dressing needs to be kept dry so as to prevent any kind of infection. So are you understanding my point? Okay, nurse, that's fine. I will try. No, you need to do it. It's very important for you. Please understand, it is for your benefit only, and it is very important. And next, I would like to ask you, doctor told you about how to take care of your hand. So do you remember? Oh, well, nurse, not really. Kind of yes, kind of no. Okay, then let me remind you that you need to take care of hand. First of all, it is very important for you to elevate your arm to minimize the swelling. And also you should use your hands only for the light work. Please do not do any work from your hands at the moment, at least for 48 hours. That means for the next 2 days, you should not try and execute any activity from your hand. Is it all good? Are you understanding? Well, yes, nurse. Okay, then taking it forward, I would like to tell you that finger mobility exercises are very important to improve the blood circulation, and it will help in the healing process as well. Further pain relief medications would be required. Whenever you feel the pain, take the medications as per the requirement. Okay, and there are few precautions which you need to take. Avoid any kind of heavy lifting or driving until the wound heals completely. It is very important that your wound should heal completely, and only after the doctor's recommendation you should use you should do driving or do heavy lifting. Until then, please avoid any activities which are heavy, such as heavy lifting or driving. Is it comprehensive? Yes, nurse, it is. Okay, then. Any doubt that you have? Do you have any other concerns? Yes, nurse, I have a concern regarding my discharge. How would it happen? Don't worry, we are about to discharge you. There is nothing to worry. And your follow-up appointments have been fixed. Here is a leaflet that contains the information about your follow-up appointment. Apart from that, it is very important to take care of your wound and medications as I have told you earlier. Hand exercises would play a great role in your healing, as I have already told you that this finger exercises, mobility exercises would really help you. Rest, the most important thing, it is very important to note if there is any fever, any swelling, or even increased pain, you need to seek the medical attention straight away. Is it all good? Yes. Okay, then here is your leaflet. And I reassure you, at this moment, your surgery has been successful and there is nothing to worry. You will have proper healing within 2 weeks. And please do not do anything that is heavy or requires more activity from your hands. Okay, have you understood? Well, yes, nurse. Okay, then great. Take care. And if you need anything, do let us know. There is also a number on the leaflet. You can contact us anytime. All right, nurse. Okay, take care. So that is how you speak your topic. Even for the doctors, this topic can be same. Trust me, everything can be same. So please don't worry that whether you are a doctor or nurse. These are very nice topics. That's why I'm covering even for the doctors. Please understand, it would be as same as task, same. 48-year-old, so you have to give this thing. There's nothing to worry then in that case. Okay, I'm Dr. Bhupesh and I'm your doctor for the day. So as you have undergone surgery of the carpal tunnel release, which was an incision of this and this thing. So how are you feeling now? Well, doctor, I'm feeling all right. Okay, that's great. And now I would like to give you information about your wound care. So first of all, I would like to tell you this is very important for you. This is very important. So are you understanding my point? Yes, doctor, I am understanding. Okay, so it's very important for you to understand that until the wound fully heals, there are proper precautions which need to be taken. You cannot swim. As I know you are a swimmer, you can't swim. Looking at your condition at the moment, so at least for 2 weeks you should avoid this thing. There is a risk of infection if you do that. Have you understood? Well, doctor, but I can't survive without swimming. I do understand what you mean, but at this moment it can be dangerous. Even the plastic is not effective for this thing. Healing can be delayed. So we are saying it for your interest only. But doctor, how would I survive? You will definitely do fine. It's just a matter of 2 weeks. After that, you can practice your swimming as much as you can. And now I would like to give you some proper instructions like elevation of hand, this and this and this, and rest. I would tell my nurse, he will help you with the discharge pack. There are follow-up appointments that you need to do. So nurse will pass on the information regarding the same. And also wound care and medication advices, which I have given, are very important. Hand mobility exercises will play a very important role. So please follow these instructions. And if you have fever, swelling, and increased pain, feel free to contact me. Here is our number on the leaflet and you can call on this number. Somebody will get you connected with me. Is it all right? Okay, doctor, that's fine. All right, then take care. That is the difference. It's just about bit of attitude that in doctor's case, we can use more of I. But if you ask me, there is any major difference between a task of a doctor or task of a nurse? No, it is just the same. It's just about little bit of attitude, little bit of I can be used when it comes to doctor. And whereas when it comes to nurse, then you can say that basically, but if you are a nurse, then in that case, basically you say that doctor has recommended you this thing, doctor has recommended you that thing. So that is the only difference. So please understand there is not much difference between the two. This is Dr. Bhupesh from Dr. BKM Institutes, and our contact number, as you all know, is 76967342256. And now I would like to take your doubts if you have any. Thank you so much.